My name is Naresh Mullaguri. I'm one of the stroke and neurocritical care doctors. I'm from southern part of India, and I'm the only physician in my family. So growing up, I was very interested in biological sciences, and I'm driven towards neurology because I lost my father to stroke, and I want to really help patients and their families to kind of prevent that vulnerable point in their life, and want to kind of help as many patients with neurological problems as possible. Acute neurological emergencies are very time sensitive. So if you really diagnose them pretty early and manage them pretty early, I think you can really change the course of their prognosis. So that's the key to why I chose neurology and acute care neurology to begin with. So I did my neurology residency training at University of Missouri, and to kind of do more training in stroke and neurocritical care. So I was dual fellowship trained at the Cleveland Clinic. So as a neurointensivist, I will be primarily working in the intensive care unit, taking care of patients with stroke, seizures, encephalitis and brain infections, spinal cord problems. So a lot of them are pretty much emergencies. So I mean, patients might stay there for a few days at their very vulnerable points. So I enjoy taking care of them during that point, and try to educate them why this happened and how they can get better from here. I'm specialized in cerebrovascular care, and South Carolina is a state where a lot of cerebrovascular disease patients unfortunately are here. So I think I chose Prisma Health because it's one of the best healthcare systems in South Carolina, and I can put my skill sets to the better use when if I come here and practice. So I would be able to help a lot more patients than if I practice in any other state. I'm pretty interested in clinical research, especially in stroke and critical care, and also very interested in data analytics, the machine learning and artificial intelligence platforms in healthcare industry. Outside of healthcare, I really like playing badminton, hiking, and really love to spend time with my family and my daughter. When patients and their families are at this vulnerable time point, especially during the ICU stay, so the things that really help them is to understand how to kind of come out of this devastating emergency, and what things that we do in the ICU are helping them. And I mean, everyone have questions about how long it will take to get better, and what sort of things that they can do to prevent this from happening to the patient again or their family members again. So I mean, discussing those points and counseling them on that, I heard a lot of patients say that it's kind of a pivotal point in their life where they haven't really took healthcare seriously and their personal health seriously until that point. So I mean, I have known and seen a lot of patients who actually took that as a sentinel sign, and I mean, kind of the whole family is kind of transformed in terms of their understanding about their own personal health and how to take care of themselves. So.